Hello everyone, I am Dr. Gagan in Jain. I am presently heading the Department of Medicine and Critical Care at Jain Hospital, New Delhi. Jain Hospital is an NABH accredited hospital situated at Pitampura, New Delhi. So today I would like to thank everyone for giving me the opportunity to speak about one of the most dreaded topics in the field of medicine, that is heart attacks and heart failure. As we all know, in the present day scenarios, the incident of heart attacks has been increasing from before it was seen in the elderly. Nowadays, more and more news and we come to know about the information that our near and dear ones are suffering at a younger age from ailments of the heart. In these cases, I think it is even more important for us to know about what exactly heart attack is, how it happens, what is the etiology behind it, what are the causes, how it can be prevented, and what are the warning signs which we can look for in our day-to-day lives so that we can prevent this serious condition from going out of hand. So before we start, I would just like to give a small idea about what heart attack is. As the name suggests, it represents about something which affects the heart. Now, why is the heart important? Heart is one of those organs of the body which starts functioning when we are 6 weeks old in our mother's womb, and it works on continuously without stopping till we take our last breath. It can be 20 years, 40 years, 60 years, 80 years, and in some cases even it crosses a century of more than 100 years. So it is one of the most actively working organ in the body. As all the organs in the body requires blood, heart also requires blood for its functioning. Heart pumps blood to all the other organs of the body, so it is also called as the support organ for the whole body. And as it pumps body for the whole other organs in the body, it also pumps blood for itself. The blood from the heart is supplied to itself by coronary arteries. There are major and minor coronary arteries. Blockage of any of these coronary arteries decreases the blood flow to the heart. Blood which carries oxygen, when it decreases to the heart, there is no oxygen, so the heart doesn't produce energy, and which causes decrease in the functioning and in severe cases even stopping of the function of the heart. So as we have talked, it sounds quite simple that the blood is traveling to the heart, the arteries get blocked. If we stop the blockage, the blood will be pumping throughout our lives. But it's a very slow and complex process by which the vessels, the coronary vessels which take blood to the heart, slow and steadily the diameter of these vessels decreases. There is atherosclerosis, which is nothing but the stiffening of these vessels. The radius, the diameter decreases, and slow and steadily as our age increases, as the cholesterol increases, the size of this plaque which blocks these arteries increases, and suddenly one fine day the patient gets up in the morning with severe chest pain and he is taken to the ER and he is labeled as having a heart attack. So now first we'll just talk about, is this disease preventable? Yes, heart attack is preventable, but is it permanent? Can we do something that this never occurs? So the answer is no. What we can do is we can prevent or we can delay the onset of this disease so that we get more and more good years of our life which are free of medication, free of any disease, and it also helps us in improving the quality of life. As the age increases, the process of atherosclerosis or decreased diameter of the coronary vessels will happen eventually for most of the people. In some cases, when it is severe, it causes an attack. So now what causes these decrease in the diameter and these plaques which we are talking about? So there are many factors. First, the most important factor will be cholesterol. High cholesterol causes the plaques formation. The cholesterol, we have two types of cholesterol, the good cholesterol and the bad cholesterol. So the bad cholesterol, or the TGs, which we call, go and accumulate in the blood vessels, causing them to become stiff, less agile, and plaque formation happens, which decreases the size of the vessel. Secondly, we have many habits these days like alcohol, smoking, drug abuse, maybe ingestion of these pan masalas, etc., which are common these days. All of them cause the vessels, they cause an oxidative stress on the body, which causes damage to these vessels, which further causes plaque formation, and finally leading up to heart attacks. Thirdly, stress is a very important factor in the plaque formation, and which causes increase in the blood pressure, and the blood pressure increase causes increase in the functioning of the heart, the pumping of the heart. The stress on the vessels increases, which eventually causes damage and again increases the rate of plaque formation. Blood pressure is a very important criteria again, as we've seen more and more patients who are suffering from myocardial infarction have a prerequisite or a history of hypertension which was uncontrolled. Hypertension is a disease which causes increased pressure in the vessels by the heart. As the pumping of the heart increases, the rate of heart pumping increases, the pressure on the vessels also increases. If a simple thing is done, that our heart rate is controlled, the pressure is controlled, many cases of MI, myocardial infarction, can be prevented. Hypertension again is a more of a lifestyle associated disease, and slow and steadily also it is an age related disease, with as the age increases the hypertension or the blood pressure also increases. But nowadays we see more and more young patients are suffering from hypertension, so it makes even more important for us to keep a check on the blood pressure, so that the patient who is suffering from an early hypertension do not end up getting a myocardial infarction or heart attacks. With the blood pressure, good blood pressure control, good cholesterol control, nice control on the stress, less of anxiety, I think most of the cases of heart attack can be prevented in today's scenario. There are many other conditions which causes MI, but I would not be talking about, and they are quite rare, or they are not out of our scope of the topic at the present. So now the other thing which I'll talk about is what happens if we have an heart attack. So when we have an heart attack, the vessels which are taking blood to the heart stop taking the blood to the heart, causing no oxygen to the heart, causing its stoppage, and finally attack. When an attack happens, the most important thing that happens is there is damage to the tissues. Now though, as the heart tissue gets damaged, its ability to pump blood also decreases. The more massive the heart attack, the more massive the damage to the heart musculature. Our most important role at this time is to prevent the damage to the musculature of the heart. That is why we always say that the first 4 hours, or the golden hour which we say, is more crucial to come to the hospital and get yourself treated. If a person comes to the hospital in the first hour, or at least 3 hours after an attack, the patient can easily undergo anticoagulation therapy. He can undergo angiography, angioplasty, where the blockage of the vessels can be opened up again. So that is why we have to educate all the people that any signs of heart attack, the patient should be taken to the hospital urgently, to the ER emergency. Now what are the signs which we have to see so that we can rush the patient to the ER? So the various signs which we see are any chest pain, heaviness of the chest on the left side, which is radiating to the left arm, to the back, to the jaw, maybe to the abdomen also in some very rare cases. If it is accompanied by sweating, nausea, vomiting, breathlessness, any prior history of hypertension, or if there is family history of myocardial infarction or any heart related problems, the patient should always be taken to the ER urgently. Now, what is done when the patient is taken to the hospital? Now, the first, a battery of tests are performed to know if the patient is suffering from an MI. But the most common tests which are done in ER is an EKG. An electrocardiogram will tell us about if the patient is currently having an infarction, what are the walls of the heart which are involved, and it can also to some extent tell us about the severity of the attack. Now, the second test which are always run in the ER are the troponin, that is the troponin I, or cardiac markers which we call them, that is the CPKMB. So what these tests does is it tells us about, it gives us a sort of a confirmation if the patient has already suffered from any myocardial infarction. As there is damage to the walls of the heart, these markers which we are called cardiac markers, trop T, trop I, these all increases in the blood. So the level of these markers are checked in the blood, and they are very reliable, as well as they are very quick in identifying if the patient is suffering from an heart attack. So after the patient is diagnosed to be suffering from heart attack, without wasting any time, the patient is shifted. If the institution has the facility of a coronary angiogram, we can get a coronary angiography done, and SOS if needed. If the blockage is quite big, we can plan a plasty even after the angiography itself, without wasting much of the time. But in setups where there is cath lab is not available, what to do? Well, see, we have many options. Even when we don't have a cath lab with us, we have a good anticoagulation therapy which can be given. We have a retiplase which can be given. We do a process called thrombolysis, in which we give a drug to the patient which causes thinning of the blood and which causes opening up of the heart vessels instantly. It has two benefits. Firstly, it opens up the vessels, so it decreases the chances of death, and secondly, it also decreases the damage to the musculature of the heart. So it has to be done urgently under 4 hours. If the patient comes to the hospital under 4 hours, this has to be done. Obviously, it is done after telling the patients about the risk of this procedure itself, which can cause bleeding. We have to ask the patient if he is suffering from any other comorbid condition like piles, if he's undergone any operation in the last 6 months, if he's had trauma, injury, etc. And only after taking these history, we will get the patient under the needle for thrombolysis. During all of this, we have a very good diagnostic procedure called as a 2D echo, that is also called as a 2D echocardiogram, in which through ultrasound guided, we do an ultrasound of the heart, in which we can see the vessels of the heart can be visualized. We can see which of the vessels are not working, which of the walls are not working, and according to that we can come to know about the present situation of the patient. We have an entity called as the ejection fraction, which tells us about the functioning of the left ventricle, and according to the percentage of LVEF, which can be 40, 35, 25, we can know about the severity of the attack. In a normal patient, we'll have 55 to 65% of EF. Anything below that, we should be quite cautious about our diagnosis. Also, we have to, whenever the patient suffers from a heart attack, we have to immediately take him to the ICU, and all of the procedures are further carried out under the strict observation, and the patient is given oxygen and other painkillers. Now, the other thing which I would like to talk about is we've already talked about how heart attack happens, what is done after an attack happens. But I think what even more important thing which is about lifestyle and how we can prevent this from happening. Now, the various things which we can do to prevent heart attacks are: we can have a lifestyle modification, we can have decreased cholesterol in our diet, we can decrease the level of salt in our diet, we can have a good exercise, healthy living can be done, we can stop all non-vegetarian food, we can decrease the fast food intake, we can do regular lipid monitoring, lipid profile, that is the cholesterol monitoring can be done repeatedly. We can get ourselves evaluated, whether 2D echo after the age of 50. We should keep a strict check on our blood sugar levels. We should keep a strict check if the patient is suffering from any arthritis or any other chronic disease. We should make sure that we keep that in check. And also the BMI of the patient is very important. So we have to make sure that the BMI is kept according to the height and weight of the person, should be within limit. And after that, the main important thing we have to keep in mind is always that our blood pressure is always under check, our cholesterol levels are under check, our lifestyle is healthy, our stress levels are reduced. And I think if we do these basic things, more or less we can at least prevent and we can delay the damage to our coronary vessels and further improve the quality of our lives, and we can even push ahead any myocardium related diseases which we might suffer in our lives in the beginning. So at the end, I would just like to thank all of you for this small talk which I have taken, and I hope this is helpful to the audience at large. And at the end, I'll just say, make sure that you keep your heart healthy, because eventually the heart has to help all the other organs work properly, and if the heart is not working properly, then the all other organs suffer at the end, and this is one of the major causes of instant death. So I think this heart attack is such a threat to the society as a whole, because it causes sudden deaths, so the families are destroyed. So this has to be a very important factor in our daily, the way we conduct our daily lifestyle modifications. So thank you everyone once again.